Hello everyone, my name is Michalina Drejza and I'm a final year medical student from Poland. I work for IFMSA, the International Federation of Medical Students Associations, as well as International Youth Alliance for Family Planning. I grew up in a small city in Poland where talking about reproductive health issues were a taboo. When I got into medical school, I realized how challenging it is to provide services and not being able to talk about sex and reproductive health issues with patients. Moreover, nobody was teaching us how to do so. Working in non-governmental organizations has given me skills for sexual and reproductive health advocacy, as well as how to address contraception and family planning issues in the office. As a future doctor, I want to be able to provide non-biased and non-judgmental family planning services for young people in my society. As young people, we are the ones being discriminated in healthcare because of our age, skin, our sexuality, sexual orientation, gender identity, or sexual and reproductive health choices. I don't want my children, if I decide to have them, to feel stigmatized while they are seeking the healthcare they want, they need, and they deserve. We are the ones facing the challenges and hoping to benefit from the developments that have been highlighted by the presenters in the other videos. Unmet need for contraception, especially among adolescent and young people, leads to unintended pregnancies, unsafe abortions, and maternal deaths. Lack of resources and lack of education make young people vulnerable. Moreover, some of these issues that are important for young people are often left unspoken as they challenge cultural beliefs about young women being able to take responsible decisions about their health and about their future. Particularly, access to comprehensive sexuality educations as well as discussions about sexual pleasure are still challenging. For young people, we are not necessarily planning families now, but we would like to be able to plan our future and be able to fulfill our full potential. To ensure that family planning progresses rapidly from its historical to the future position as presented, and that we take advantage of all of the efforts of the WHO and others, we must pay attention to voices advocating for contraception for youth and adolescents, as well as for meaningful youth participation in family planning programs. Voices that young people should have equal access to contraceptions and be brought to the table to be the part of decision-making processes. This is captured in a popular catchphrase, "Nothing about us without us." Youth participation is extraordinary opportunity to bring up not only our youth perspective to challenges, but also the real solutions to galvanize youth-friendly family planning services on the local, national, and international level. The world is facing one of the biggest number of young people entering their reproductive health in the history. Millennium Development Goals has left us with unfinished business, and as it was mentioned in the other video, last September brought to us the new Sustainable Development Agenda with 17 goals, which are very ambitious. The young people of today will largely contribute to the achievement of Sustainable Development Agenda by the year of 2030. To achieve this, we need platforms to mobilize the generation of champions who will work on innovations to implement and scale up family planning guidelines and resources using new technologies and engineering to ensure universal access to sexual and reproductive health and rights for all. However, without sustainable investments such as mentoring programs and seed grants, we will not be able to fulfill our full potentials, and the youth participation will remain largely symbolic. Today, we need to challenge old assumptions and lead the new agenda. Challenges of today, such as adolescent pregnancies, gender inequality, lack of access to contraception, lack of access to comprehensive sexuality education, will be inherited by the youth of tomorrow. With more than half of the world population being under 25, it deserves the full attention of all the stakeholders at all ages, and we should start education of providers at the stage when they are still in training, as many assumptions stigma can be addressed at this stage using good practices, sharing and opening the outside of the box discussions, leaving all assumptions behind. Innovations such as WHO tools and guidelines, as well as new technologies used for contraception, should be introduced early during the training process. It cannot be done by one person on video. It requires partnerships and investments at international, regional, country, and local level. So what are young people's recommendations for the future of family planning? Let's listen to some of the youth voices for sexual and reproductive health future.
I am from Nigeria and I believe youth-friendly services should be made available to every youth everywhere all over the world.
Young women and girls should have full access to family planning and contraception, and we should make more investments to make sure they get the services they deserve.
If I could give one recommendation to policymakers, it would be to remember that youth are not just the leaders of tomorrow, they are leaders right now in their communities and should be considered and incorporated into every level of decision making, especially if sustainable development is the goal.
Young people need to be put at the center of the response. They need to be consulted, they need to be engaged, and they need to actively participate in all processes so we understand truly what their needs are and what their expectations are.
Because family planning is an important issue for the young people.
Gender equality is feasible and men should support women in their sexual reproductive health choices because we are equal.
We advocate for young people to be actively involved in family planning and contraception because we are tomorrow's parents.
We heard the voices of young people from all over the world. Global thoughts and concepts need local actions and solutions that can be reached when young people will be taken to the decision table as equal partners of the conversation. As young people, we look forward to benefiting from the vision of a future where contraceptive products will be safer, offer more choice for women and men, be easier to access from a wide range of outlets, offer greater control by the user, and be more affordable and more user-friendly. Our future and the future of further generation is truly in our hands, and as our decisions whether to end certain stereotypes and ensure universal access to sexual and reproductive health for all, to keep sustainable development agenda as our promise.